Hi, Kai. My name is Anya. I'm going to conduct a head-to-toe assessment with you. So I already washed my hands with soap and water. And then next is prior to doing your assessment, I would like to take your vital signs. I will take your blood pressure, respiration, your heart rate, and your oxygen saturation. And we're just gonna pretend that I'm going to get your temperature as well, okay? Thank you. Okay, so it's 110/67. Now I'm just like counting your respiration. Okay, respiration is 18. And then your oxygen saturation is 95 and your heart rate is at 62. Any questions? 1 second. Okay, so we will begin our assessment with the integumentary. Okay, so before I start, is there any concerns regarding your skin, your hair, and your nails? Okay, so I will do an inspection for your skin, particularly on the your skin color, your texture, moisture, and any lesions or rashes. I also will inspect your hair for the color, for the texture, distribution, and any signs of infestation. Also, while doing all this, I will also inspect your nails for the color, for the shape, and the texture, and also if there are any signs and symptoms of any infection or trauma. Okay. So next with the inspection is I'm going to palpate. So I'm going to palpate your head, your skull. So mainly I'm looking for any contours, depression, that if there's a normal occiput at the back of the head, and then I'm going to move at your the hair, make sure that it's good hair distribution, there's no lumps or bumps on your skull, and also I'm looking for symmetry for any facial or involuntary movements, and then any scarring or lesion as well. So is there any other concerns? Okay, good. So next, since I did the inspection and the palpation of your skin, next is we're going to go to the head, and the head eye examine, for the head and eye examination. Okay, so first is I will inspect for Curla. And then I'm going to inspect the cranial nerve 3, 4, and 6, and as well as the cranial nerve 2, which is the optic nerve or the visual acuity. So first we're going to do the cranial nerve 3, 4, and 6. Okay. So first I want you to so we're gonna do the reflex, the accommodation reflex. So I want you to look in a distance. We can focus your eye on your eye so we can see. We can focus the camera on your eye so we can see that. So go look at the distance, And then after that, look on the tip of your nose. Okay, good. And then we're gonna inspect for the eye movement, okay? So I want you to gaze upward, going to your left. Just follow my instructions, okay? Go to your left and then go to your right. And then I want you to gaze horizontally to your left, and then gaze horizontally to your right. And then gaze downward to your left, and then gaze downward to your right. Okay, so also with another alternative in doing that is we can do like you can look at my like the tip of something here, and we can do like the H movement. So you just follow the tip. Okay, so that's the cranial 3, cranial 4, and 6, which tests the eye movement. So now we're going to go to the cranial nerve 2, which is the visual acuity. So I want you to look at that Snell chart. Okay, cover your left eye. And then I want you to read line number 6 from left to right.
E, D, F, C, Z, P.
Okay, now you're going to do it on the other side as well. Good. Can you read number 6, please?
Yes. P, Z, C, F, D, E.
Okay, good job. So now we're gonna move to mouth exam. So I will have the patient open his mouth, and then I have the light of the otoscope, and I will have the patient stick his tongue out. Okay. So I'm going to inspect the oral mucosa, the gingiva, the oropharynx, tongue, and also see if there's any lesion inside your mouth or anything. Okay. So can I just open your mouth? Say ah. Put your tongue out. Okay, good. Any pain in your mouth or something? Okay, good. So next I will do an inspection of your nasal mucosa. I will look for the color, I will look for texture, I will look at the intactness, if there's lesions or any edema or any discharges, okay? So I'm going to inspect the nose from the outside, looking for any obvious deformity. I'm going to look for, looking at the ala. I'm going to flex your neck so you can look up at the end. And then I'm going to press the tip of your nose. With the use of my stethoscope, I will turn on the light, and then I will place it inside your nostrils, and then I will look at the mucosa and then see if there's any abnormalities, okay? Any problems with your nose?
No.
Okay, good. So now we're gonna go next to the sinuses. Okay, so I will just do a palpation of your frontal and your maxillary sinuses. Okay, so the frontal sinuses, I'm just like, you know, feeling for any lumps, any bumps, or any abnormalities, and then your maxillary. Okay, good. And then now we're going to go to the thyroid and the cervical and the submandibular lymph nodes. Okay, so I'm going to inspect the neck for alignment. Make sure that the trachea is midline and there is no massive torticollis or twisting on the neck. So all lymph nodes start with a pre, which means before. So I will palpate with your ear the lymph nodes with the pad of my finger. using an ocular motion. And then your tonsils. And then also, I already assessed for the size, shape, consistency, tenderness of each lymph node. So note if there are any abnormalities, there should be an enlargement or tenderness when I was palpating your lymph nodes. Okay, so next is we're going to do a visualization of your ear canal and tympanic membranes. Okay, so let me get my otoscope. So I will start with an inspection. So I'm going to place the otoscope in your ears, looking at the extra canals for any discharges, drainage, signs of infection, or if you have any inflammation inside your ear. Okay. Okay. So let me do. Okay. And then next is we're going to check your hearing acuity. Okay, so there's two type of tests where we can test hearing. One is the Weber test, and then the other one is the Rhine test. And then with this one, I will use a tuning fork. So for the Weber test, I will assess for the conduction into the ear. So I will strike my tuning fork and place it in the forehead on the top of your crown of the head, and then you will tell me if you hear or you feel it, okay? So do you hear anything or feel it? Okay, good. And then now we're going to do the Rhine test. So Rhine test is where we strike the tuning fork and place it at the back of your ear. And if you can hear it and place it in front of, when I place it in front of your ear, front of your ear to hear the vibration, okay? So I'm gonna hit it and then put it at the back of your ear. And then can you hear it?
Mm-hmm.
Good. Let me do the other side, okay? So again, the same, hit the, and then I'll go put it there and then tell me if you hear. Okay, good. Good job. So next we're going to go to the respiratory system. So first I will assess all your lobes and inspect for the same thing. Would you be able to take off your shirt for me?
Mm.
Okay. So first I will be inspecting your thorax for shape, for the size, for any movement, for the depth of your respiration. Is it shallow? Is it medium? Is it deep? And also your effort of breathing. Is it labor or is it there's labor or unlabored breathing? Okay. Okay. So next is we're going to palpate for excursion and symmetry. Okay. Okay, so so at the back of your so we're gonna do the lung expansion, okay? So at the back here, can we focus on here and like so to see? So Kai, can you do deep breath? Okay, one more. Good job. So. And then we're gonna also do, can you stand up for me and face over there, please? So we're just gonna do like a percuss. Okay, so that's the percussion. And then next is I will going to be listening to your lungs. Can you do deep breaths for me? Okay, so with the lungs, the front side or the patient's anterior chest. So I was, you can actually like also do like I'm also gonna listen to your backside. Deep breaths for me, please. So with the use of my diaphragm, I listen to your lung fields, and so most of it is like the sound of the breath sound should be normal. Okay. So it's like for the advantageous of breath sounds for the anterior and superior, anterior and posterior. So usually when we do this, we do it in a systematical way. Okay, so so another part of the palpation is also to check for lung expansion, which we did in the back earlier when I asked you to do a deep breath, and then my hand, my finger, when you were exhaling, it expanded. Okay, and then for the lateral aspect of both arms is the best area to check the right middle lobe. So listen for the normal lung sounds, which is on the posterior aspect, and the chest is mostly to be vesicular. On the anterior side, you can get some tracheal sounds up in the via trachea, and you can get some vesicular tracheal sounds up in the anterior posterior of your chest. But the majority of the lung field should be vesicular, and also advantageous sounds, which are abnormal sounds, including the crackles. Okay, so this is where the best area to check for the right middle lobe is in here. Just lift your arm there. So it's like a triangle. Deep breaths. Okay, and then we're gonna go in this side. Still the same. Okay, good job. So so that concludes our respiratory system. Okay, so next we're gonna do the cardiovascular. So first I'm gonna inspect for like hips and lips. Okay, so this is how we inspect for the hips. So I'm just like inspecting it, and then now I'm palpating it. Okay. And then, so I'm gonna palpate for the peripheral pulses. Mainly, I will palpate your radial and your pedal pulses. So for the radial, so with the 3 fingers, I will be assessing your pulse. So it should be absent, should be weak, regular, or bounding. So +1, +2, +3, and +4. Okay. So it's the same. Can I see your other shirt? So you can just put your shirt on here. You can just lay it there, and then let me see. Okay. So for this one, it's regular pulses. So now we can, I'm gonna remove your shoes and then, sorry. Okay, and the other one too, because I'm gonna do the pedal, okay? We can just remove the whole thing. And now I'm gonna assess for the pedal pulse, okay? So this is where the pedal pulse is. So it's the same. We're gonna, so 0 is absent, weak for 1, and then 2 is regular, and then regular, and then bounding. So your pulse is regular, okay? Okay, so next is we're going to check for capillary refills. Okay, so can I check both? Let me see. Okay. So when you pinch it, and then when you look for the capillary refill, just make sure that the capillaries are responding well. Okay? There, see, when I pinch it, it's turned white, but then it turned to pink after that. Okay? So, and then now I'm going to auscultate your heart sounds. So first is the aortic, and then pulmonic, and this will be the Erb's point. And then the mitral. And then this one is the tricuspid. Okay? So usually you can listen to like both the bell and the diaphragm. Again, the aortic, pulmonic, the Erb's point, then tricuspid, and then the mitral. So when you're listening for murmurs, you're listening for a normal S1, S2, any extra sounds like S3, S4, or split S2s. Okay, so if you might hear like a split S2, which is the sound of a pulmonic and the aortic valve closing separately, usually they close together to form S2. Okay, and then now now we're gonna go to doing the Hohmann sign. So Hohmann sign is, so when you perform it is, I will do a dorsiflexion of your foot, and then I will palpate your cup and squeeze it, and then at the same time. So if it produces pain for you, then it's positive that you have a positive Hohmann sign. Okay? So this can lead down to a path of suspicion of having a deep vein thrombosis. Okay, so can I have it? So just flex like that, and then I'm gonna squeeze your here. So if there's a positive, if you're having pain, then you have a positive Hohmann sign. Okay. Okay, so that concludes our cardiovascular assessment. So now we're going to do gastrointestinal assessment. So I will have you lay down over here, please. You can go like the camera here. So you can focus on here. Okay, so for the abdominal area, we want to inspect the general appearance, like to see if there are signs and symptoms of any issues, any problems. So I will inspect it for shape, looking for any pulsation, any movement, pulsations from the aorta, the peristalsis, or the waves of the bowels, which is a lot of times you can see, and obviously when you breathe in and out. Okay, so next is I will do an auscultation. So using my stethoscope, I will listen to the bowel sounds in each quadrant. So right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. So I'm just gonna listen. So when I'm listening, I'm gonna listen for tingling, for pinking or tinkering or pinging of the bowel sounds, okay? So normally the bowel sounds, it should be, the normal should be 5 to 30. Anything that's low is hypoactive. Anything that's higher than that is hyperactive. And if I don't hear anything, then it means that it's, there's absence of bowel sounds. So I'm just now ausculting. I'm in the right. We can focus on the stomach, right, and then left lower quadrant, and right lower quadrant. So the next part of the auscultation is going to be the palpation or the percussion. So I'm going to start with palpation. I'm going to start with palpation. Okay, so then next we're going to do the percussion. So percussion is a technique that requires some skills and practice, but generally you take your dominant finger, your right hand, in the middle finger of your dominant hand. Using the right hand, you will strike the distal joint of your dominant hand with your middle finger. It's a quick strike, and then flip it up, and you don't really hear the dull noise so lightly. So just percuss in all 4 quadrants of the belly, listening for tympanic sound, which is like a sound of a drum. Okay, so in percussing the liver border, you have to start in the mid-clavicular line around the umbilicus and percuss upward. Until it changes for tympanic to a dull sound. Once you hear the dull sound, you can mark then the level, and again start superiorly. Go between the rib margins, because if you percuss in the ribs, it's going to be a dull sound. So you want to mark the liver border, which should be between anywhere to 4 to 7 centimeters. So normally it's between here and here. So that's going to be your liver. Okay. Next part after the percussion of the abdomen is to palpate it. So start with a light palpation using the pads of your fingers, and lightly palpate in the right upper quadrant, left upper quadrant, left lower quadrant, and then the right lower quadrant. So just any cold, make sure that you explain it to the patient, because if any coldness, they would usually they feel uncomfortable with it, so you have to let the patient know right away. So make sure that the patient is relaxed. So with the abdominal examination, it's usually you have to inspect it, you have to auscultate it, and then after the auscultation will be the percussion, and usually what we do last is the palpation to get a better assessment of the abdominal area. And then next is we're going to perform the McBurney's test. So McBurney's test is I will have my patient flex your knee. Okay, flex your knee. And then I will flex your knee, and then I will internally and externally rotate the knee. So if the patient complains of any pain, then that is a positive sign that he might have appendicitis. Okay, so next is we're going to go for musculoskeletal. Kai, would you be able to sit down at the edge of the bed, please? Okay. So first, we're going to inspect for range of motion of your shoulder and your hip. Okay, so first we're going to do abduction of your shoulder. Abduction, please. Abduction. So you're going to start and abduction. And then for adduction, we're going to start on the top and then going down. So that's the adduction. Okay? And then now we're going to do the flexion of your shoulder. Flexion. Do it again. And then at the back, extension. Okay. Extension. Okay, good. Now we're gonna do the hip. So if it's okay to lay down again on your back. Here. Okay, here. So we're gonna do abduction first. So can you put it here? So you will like pull like that. Sorry, like you will just like do like that. Okay. Okay, there. And then, okay, so that's abduction, and then adduction will be away from your body. Okay, good. And then we're gonna do the flexion. Bend your knee. Flexion. Do the other side, please. Flexion. Good. And then now I want you to lay on your stomach, please. And then now we're gonna do the extension. With your left extend, okay, and then next is the right extend. Good. Is there you can now lay on your back. So now we're gonna assess for any pain. While we're doing the range of motion, are you experiencing any pain at all?
No.
Okay, so no pain at all, right? Okay, so now we're gonna just test for like strength for your can you sit down for me, please? Okay, so I will push your shoulder and I want you to go against resistance. So okay, one more. Okay, and then put your arms. And then, okay, go against resistance. Good. And then also we're gonna do the legs. So I'm gonna push it, good. And then the other side, good. Good. So now I'm going to assess your posture for any scoliosis, okay? So I want you to stand up and then face over there. So as you see, you have to like push it there. So there. And as you see, that's the posture. And I want you to like bend a little bit so I can tell for the scoliosis. So if the patient has scoliosis, you can see that there's like an S shape on his spine. But obviously the patient has no issues with scoliosis since his spine is well aligned. Okay, so now Kai, you can sit down again, please. Okay, thank you. Okay, so now we're going to do the neurological. So we're now going to do the respiration. The genitourinary assessment. So palpating the kidney and the bladder. So to palpate or isolate the kidneys, the ureter and the bladder, low back pain at any time can be affected by kidney issues. So treating the bladder may be necessary to resolve any tension in the pubic bone. So whenever there is the atrocious strain palpated or just the pubic bone issue at the pubic symphysis, the kidney lie directly under the rib cage, and on the right side of the inferior and to the left where the ureters come out, and medial aspect of the kidneys come down to the bladder. So we will palpate over that region. Okay, so Kai, can you stand up, please? So on your back, so this is what we call the costovertebral angle tenderness test. So the CVA is found in patients who may have kidney infection because it has it is inflamed from the infection, and then when you take your hand on the butt and thump or percuss, it will cause patient tenderness. So how we find this is that we will find the last rib posteriorly. So it's on the 12 rib, so which is on there. And then you're gonna put your hand and then make a fist, and then you will thump your hand, and I will ask the patient to tell me if it's causing him any pain. So I will thump it, and you tell me if there's any pain, okay? Okay. And then the other side, is there any pain? Okay, so that's how you do the CVA to check if there is any issues with his kidneys. So now Kai, you can sit down. Okay, so next is we're gonna do the neurological test. Okay, so first I'm gonna assess for orientation. I will ask the patient a series of questions, and I will see if he's able to answer it. Then we can tell if the patient is alert, oriented. Either if he answered all of the question, then he's alert and oriented ×4. Okay. So can you state your name and your first name and your last name, please?
Kai Estorpe.
When is your birthday?
January 17, 2009.
Do you know where you are where are you at right now?
Yes.
Okay, where are you? Hospital. In the clinic?
Oh.
Where are you right now?
Clinic.
Okay. And then what are we doing right now?
During exams.
Doing examinations, okay. And then do you know who is the President of the United States?
Biden.
Okay, President Biden. So the patient was able to answer all my questions, so I can say that he's alert, oriented ×4. Okay, so now we're going to do the patellar and the Achilles reflexes bilaterally. Okay, so let me tell you first what is the, for the neurological exam, which is the Achilles reflex. So with a hammer, I will hit the Achilles, with the hammer, we're going to do the patellar reflex first. So first, I'm going to locate the kneecap, which is on here. Is there any way we can, right there. First, I'm going to locate the kneecap, and then you will yeah. First, I will going to locate the kneecap, which is this one. And then once you located the kneecap, you will just go a little bit lower below it. And the best way to have is the patient to extend his leg out. Okay, good. And then the tendon will pop out. So that's the tendon. So put your hand behind the knee for support, and then I will tap it briskly using my hammer. So I will put my hand on here, and then I will use my hammer, and I will just tap it lightly where the air. So just relax. Okay, 1, 2, 3. Okay, there. 1, 2, 3. So we're gonna repeat it on the other side. So first, you're going to locate the patella, which is that, and down below it, just down below the patella, you will find the tendon. So the best way to see it is like have the patient extend his leg, and that the tendon will pop out. So again, you will like tap that area briskly, and then you will see the reflex. patellar reflex, okay? So support, and then now you're gonna just relax. Okay, one more. So that will be the patellar reflex. So next is we're going to do the Achilles tendon. So with the hammer, you hit the Achilles tendon. Where is it? Behind the ankle and the posterior aspect of the ankle. And watch for the foot to flick. But you can alternatively do this with the patient kneeling on the chair so that the Achilles is up in the air and you're gonna be hitting it. But since he's positioned like this, I will try my best to like see. So at the posterior, where is that tendon is here at the back of his ankle. And then now we're gonna hit it. Okay. So do you want to let's see if I can have you kneel on a chair. Okay guys, can you kneel on the chair over here? So just stand up. So just kneel on the here like that, and then we can so that's the and then you will just hit that area. See, did you see that? Okay, there. So you see that it's like, so now we're gonna do the left side again. Okay, so that's how. So the last examination will be the Romberg exam. So I will have the patient stand up and have his arms, so you can just stay over there. Yeah, and I will have his arms out and palms up. Palms up, please. And then I will have the patient close his eyes. And note that he can stay in this upright position with a minimal swaying without losing his balance. Okay, good. So that concludes my head to toe assessment. And thank you, Kai, for having me do the head and toe assessment with you. Is there any questions? Okay, thank you very much.